So when the dialogue started with Norway, this was excellent because it provided an opportunity to translate some of the targets of the regional strategy in an initiative that would enable us to provide intensified support to this region on these topics.
Different areas of expertise came together to address complex issues related to HIV, related to sexual health, sexuality, adolescence health, but with a human rights approach. And that's the beginning of this project.
This was one of the first times when in our organization, HIV program of work, adolescent program of work, and human rights came together and articulated this initiative, the proposal, together with some other departments that were also important, such as health systems, gender, and cultural diversity. Youth participation is essential. We know that it's a co-principle of working for youth. You cannot work for youth without working with youth, even though it's not always easy. But some of the things that I can mention that were done consistently throughout the project was to ensure that adolescents are always part of activities, and not just in the implementation, but also in the planning of seminars, regional seminars, but also on country level. Adolescents were always involved, and they always participated, and they received an opportunity to express their point of view. We also concentrated on strengthening networks of adolescents. Effort was made in strengthening of different networks, including a network of adolescents living with HIV, and also a network of adolescents involved in programs who engage in peer education, peer health promotion, and we saw some very incredible results of that, of adolescents getting involved. And there was a big regional meeting on digital youth, where youth had leadership in the organization, presentation of that meeting. And building on that, we are now establishing a network, a regional network.
It was one of the first times where PAHO was addressing the right to health and the right to the enjoyment of the highest attainable standard of health with non-traditional partners at the level of the ministries of health, because involve laws, involve decisions of the judiciary. And of course, these are complex issues that require also education, sexual health education, which is a right, and disseminate these issues also among teachers, students, with the participation of adolescents and youth. Over the years in this project, we try to address sexual and reproductive health in the context of human rights, involving partners that were working on human rights at the United Nations level. We work also at the regional level very closely with the Inter-American Commission on Human Rights. And at the national level, we involve other ministries, such as the Ministry of Education and the judiciary. PAHO's collaboration and technical opinions presented with the health authority to these tribunals became key in order to clarify to judiciary some of the standards and norms on the right to health and the right to sexual and reproductive health that protected adolescents. And this was a new way of doing technical collaboration necessary, because some of these decisions are not only taken at the level of the health authorities, but also at the level of the other branches of the government.
Partnership was important throughout the project, not only because different agencies work in different ways in the countries on the same topics, but also to maximize the resources. And so in all our activities, we sought to include partners who are involved in this topic. And I can mention the World Bank. Other UN partners were important. We worked closely with UNFPA, with UNICEF, with UNAIDS, and I think on country level the same happened, not only on regional level, but on country level the same happened, where multiple partners were invited to be part of the implementation of the activities.
We thought that it would be important to capture the message on the right to health of adolescents, and especially complex issues such as sexuality and the right to sexual and reproductive health, with very powerful symbols. And we picked the kite because it would be impossible for adolescents and youth to fly those kites without enjoying the right to health and other related human rights. And then it came the symbol of the umbrella late in the project, because we understood that health law represents protection and protect adolescents against obstacles and barriers that can affect their health, and there are legal barriers too. So the umbrella represents protection. I think that there are conceptual developments, practical developments, and normative developments. Countries begin to have more clarity about the importance of adolescents' health as a right. Governments and other stakeholders begin to understand more clearly what is the right to sexual and reproductive health as part of the right to health, and how important is to promote and protect this right in the context of well-being and sexuality. And the project gave that a space to speak about these health issues in the context of government obligations and human rights obligations, and with the participation of actors that had been invisible before. PAHO facilitated, with the support of health authorities, the reform of national policies, plans, and laws in a manner consistent with human rights, norms, and standards. One of the major accomplishments of the project was to facilitate a sub-regional plan of action and declaration to reduce early pregnancy in adolescents. And this happened at the level of the countries of Central America in the SICA, where countries met and discussed how to have very clear guidelines and mandates with regard to the reduction of early pregnancy, but in the context of the Convention on the Rights of the Child and the Convention on the Elimination of Discrimination Against Women. And I'm mentioning this declaration because it was one of the first times that I saw that at the sub-regional level, youth and adolescents, organizations of adolescents, and leaders, young leaders, met and had their own meetings to say what they wanted to see in that declaration in the context of the Convention on the Rights of the Child, and other human rights instruments. So it was a true participation and exercise of the basic human rights of adolescents.
We are, in our whole region, we are living in a context of a concentrated epidemic, and that means that specific groups are more highly affected than others, and that there's generally low prevalence. And so what was so good and so such a benefit for this project is that in this type of context of an epidemic, you need to have an integrated approach, not a vertical HIV prevention approach. And so what we did was, during the activities, all our efforts, the tools, the activities, applied a comprehensive sexual reproductive health approach with HIV prevention incorporated. Because the same adolescent who has a problem with HIV, that same adolescent has a problem with safe sex, with prevention of unwanted pregnancies. And so we focused on building the capacity for a comprehensive sexual reproductive health approach in these countries. And I think what we achieved was that in almost all the participating countries, the HIV prevalence, the estimated HIV prevalence among adolescent males remained stable or went down. I think we have generated a momentum with this project that is very important, and we have seen different partners taking over different areas. For instance, what I would like to mention is a sub-regional strategy for prevention of adolescent pregnancy that was coordinated by COMISCA, the sub-regional integration mechanism for Central America, and that they're now running with that, and we are now a partner in implementation. The activities of this project contributed directly to the development of this strategy, and we will continue to support that. And so I think we have achieved sustainable changes. However, I do believe that the project provided an opportunity to invest financially at a more elevated level. And PAHO is not a funding agency, we are a technical partner, and so we do need more funds because this is an important issue. HIV, adolescent sexual reproductive health, it does not go away easily, as I mentioned, and so continued work is needed. And so we are looking for opportunities to generate resources, additional resources, to continue with this work.
The project had an impact, sometimes not discussed much, which was how all these developments that the project was supporting in countries were also developing new mandates in this room, in the governing bodies of PAHO. There was the discussion in this room by ministries of health, by the Directing Council, for the first time, of the first resolution on health and human rights in 2010, which is a milestone in governing bodies of PAHO. It was the first time that any body of the World Health Organization, any region of the World Health Organization, was approving a resolution on health and human rights. And the concept papers that supported that resolution show results of the Norway Initiative. A second development that I see very linked to this project happened in 2013 in this very same room, which is the first resolution in any region of WHO that refers to LGBT health, access to health, and access to health services for LGBT, including youth. And again, when you read the concept paper that supports this LGBT resolution of 2013, the Secretariat introduced results and activities facilitated by the Norway project. So you see two clear mandates that were generated by the Norway Initiative that are guiding our future.